7 popular exercises that most often injure shoulders after 40. The complexity of the shoulder joint makes it especially vulnerable as we age. Our tendons lose elasticity, our ligaments become less resistant, and our recovery capacity diminishes. The numbers are shocking. More than 35% of men over 40 who practice weight training suffer shoulder injuries. It's an alarming number, and the most concerning thing is that many of these injuries are caused by exercises that these men have been doing for years, without realizing they are silently deteriorating their joints. That's why today you will see the 7 exercises that most send men over 40 to the operating room. These exercises that we will discuss not only have a greater injury potential for mature shoulders, but also offer a greater margin of error in execution, multiplying the risks. And let's be honest, how many gyms really offer adequate supervision? Small technical errors, when repeated for years, can turn into chronic pain and avoidable surgeries. Exercise number 7, front raise. When we perform the front raise, we are placing the tendon of the supraspinatus muscle, one of the 4 tendons of the rotator cuff, in a position of compression against the acromion, that bony projection at the upper part of the shoulder. With advancing age, this subacromial space naturally decreases, and this repetitive movement can accelerate tendon wear, leading to a painful condition called impingement syndrome. What makes this exercise particularly dangerous is that symptoms don't appear immediately. It's cumulative damage. You can do front raises for years without apparent problems, until one day you wake up with acute pain that simply doesn't go away. And then the journey begins. Anti-inflammatories, physical therapy, infiltrations, and in more severe cases, surgery for decompression of the subacromial space or repair of the torn tendon. Another problem with the front raise is excessive load on the acromioclavicular joint, especially when we use heavier weights in an attempt to progress. This joint was not designed to support constant vertical loads, and repetitive stress can lead to early arthritis in this region. The good news is that you probably don't even need this exercise. If you already do shoulder presses in your workout, your anterior deltoid is already being widely recruited. Additionally, almost all chest exercises, such as bench press and chest fly, also significantly activate this portion of the shoulder. Exercise 6. Bench presses with elbows too wide. When you keep your elbows very far from your body during the bench press, extreme horizontal abduction of the shoulder occurs. In this position, the head of the humerus is forced against the anterior portion of the joint capsule and the glenoid labrum, that ring of cartilage that deepens the shoulder cavity. Over time and repetition, this can lead to premature wear of these structures and even labrum injuries, which are extremely painful and frequently require surgical intervention. Another serious problem with very wide elbows is the disproportionate stress on the rotator cuff tendons, especially the supraspinatus and infraspinatus. These tendons are naturally more vulnerable after 40 due to decreased blood flow, which reduces their repair capacity. When you repeatedly place them in extreme positions under load, you are practically creating the perfect scenario for a rupture. Symptoms of an injury caused by bench pressing with elbows too wide can start subtly. A slight pain in the front or side of the shoulder that appears only during exercise, but gradually becomes present in other movements and even at rest. Many men ignore these initial signs, believing it to be just temporary discomfort, when in fact it's the body signaling that something is wrong. The solution is surprisingly simple. Bring your elbows closer to your body during the movement. The ideal angle for most men is one where, during the movement, the forearms are perpendicular to the floor, forming an angle of approximately 45 to 60 degrees between the arm and the trunk. This position better distributes the load between the chest and shoulders, significantly reducing stress on the more vulnerable structures. Additionally, keeping your elbows closer to your body allows a more natural trajectory for the shoulder joint, respecting its biomechanics. You not only reduce the risk of injuries, but you may also discover that you can progress better in terms of strength as the mechanical efficiency of the movement improves. Exercise 5. Upright row. The upright row was long considered one of the best exercises to develop the shoulders, especially the lateral portion of the deltoid and the trapezius. However, the fundamental problem with the upright row is in the mechanics of the movement. When you pull the bar or dumbbells vertically to chin height, your shoulders enter a position called anterior flexion with internal rotation. This specific combination forces the head of the humerus against the acromion, creating what specialists call subacromial impingement. Between these two bones exists a structure called the subacromial bursa and the supraspinatus tendon, part of the rotator cuff. After 40, these soft tissues are naturally more worn and less elastic. When repeatedly compressed during the upright row, they can become inflamed, causing a painful condition known as bursitis or supraspinatus tendinitis. Additionally, this exercise places significant tension on the tendon of the long head of the biceps, which passes through the bicipital groove at the front of the shoulder. Over time, this repetitive tension can lead to bicipital tendinitis or even displacement of the tendon from its natural groove. Symptoms of an injury caused by the upright row usually begin as sharp pain in the upper or lateral part of the shoulder during movement, which can eventually radiate to the arm. In more severe cases, you may feel constant discomfort, pain when raising your arm laterally, or difficulty sleeping on the affected side. To replace the upright row, lateral raise with dumbbells is an excellent option, as long as you maintain some precautions. Don't exceed the shoulder line, maintain a slight flexion of the elbows, and avoid using body momentum. Another superior alternative is the lateral raise on the cable. This exercise has the advantage of maintaining constant tension on the muscle throughout the movement, which can lead to better results with less weight. The pulley also allows you to adjust the angle of traction to find the most comfortable position for your specific shoulders. For the trapezius, which is also worked in the upright row, you can substitute with controlled shoulder shrugs or bent-over rows with a wide grip, which activate the middle and lower trapezius without placing the shoulder in compromising positions. Exercise 4. Pullover. The pullover is an exercise that has crossed generations in weight training, often promoted as a movement that works both the chest and the back. This promise of 2-in-1 has made it popular. During the pullover, your arms are extended well above your head, placing the shoulder in an extreme position of flexion. In this position, the head of the humerus is forced against the posterior portion of the shoulder joint capsule, a structure that already tends to become more rigid with age. This extreme range of motion repeated regularly can lead to micro-injuries in the joint capsule and excessive stress on the glenohumeral ligaments. Another critical problem with the pullover is the stress imposed on the acromioclavicular joint, that small junction between the clavicle and the acromion. When you move a large weight in that wide trajectory behind the head, that joint is placed under significant tension at an angle for which it was not designed to support load. Over time, this can accelerate arthritis in that joint, resulting in chronic pain and limitation of movement. Warning signs usually include pain in the back of the shoulder during or after exercise, discomfort when lying on your back with arms extended, or a sensation of instability in the shoulder. Unfortunately, many men confuse these pains with the normal burn of training, allowing damage to silently accumulate. A much safer alternative to work the lower pectoral is the high pulley crossover. In the crossover, you can adjust the position of your body in relation to the pulleys to find the angle that best adapts to your individual bone structure. Another advantage of the crossover is that you can easily modulate the depth of the movement, avoiding those extreme final positions that are precisely the most risky in the traditional pullover. Before we continue to number 3, don't forget to subscribe to the channel. Having constant access to correct and science-based information is what will make you progress with health in the long term in the world of weight training. Exercise 3. Dumbbell Fly. This exercise can definitely represent a serious risk to shoulder health in the long term. The fundamental problem with the dumbbell fly is in the mechanics of the movement. When you open your arms laterally with elbows slightly flexed, the shoulder is placed in a position of extreme horizontal abduction. The risk intensifies in the lower part of the movement when the arms are open and the dumbbells near chest level. At that point, the anterior ligaments of the shoulder are at maximum tension, while the rotator cuff muscles work intensely to stabilize the joint. This combination of ligament tension and muscle activation under load, repeated regularly, creates the perfect scenario for injuries. Another serious problem is that dumbbells follow a fixed trajectory determined by gravity, which may not be ideal for the individual anatomy of your shoulder. With age, many men develop small changes in bone structure or accumulate years of compensatory movement patterns, making certain trajectories potentially harmful to their specific joints. Warning signs usually begin as sharp pain in the front of the shoulder during the deepest phase of the movement. Over time, this pain can become chronic and manifest even in daily activities, such as putting on a shirt or reaching for something on a high shelf. The safest and most effective alternative is the machine fly. This variation offers several crucial advantages for your shoulder health. First, the machine allows you to adjust the arc of movement to find the range that is safe, specifically for your joint structure. Additionally, the machine mechanism distributes the load more evenly throughout the movement, in contrast to dumbbells, where resistance varies depending on position. This reduces peak tension on the more vulnerable structures of the shoulder. Another significant advantage is stability. The machine eliminates the need for extreme stabilization by the rotator cuff muscles, allowing you to focus on working the pectoralis major without overloading the more delicate structures of the shoulder. When using the machine fly, make sure to adjust the seat so that the machine's axis of rotation is aligned with your shoulder joint. Exercise 2. Behind the neck military press. Continuously doing this exercise for years is practically begging for an injury. This movement was once considered a fundamental exercise for building impressive shoulders. However, modern biomechanics science has revealed that this movement can be particularly devastating, to the point that many experts classify it as one of the most dangerous exercises. Your shoulder is forced into an extreme position of external rotation combined with abduction. This position places immense stress on the anterior shoulder capsule and glenohumeral ligaments. The result is a significant increase in the risk of joint instability and impingement syndrome. Even more alarming is the effect on the rotator cuff, especially the supraspinatus tendon. When the arm is elevated and rotated backward, this tendon is compressed between the head of the humerus and the acromion, a condition known as subacromial impingement. After 40, this space already tends to be naturally reduced due to degenerative changes in the acromion and decreased elasticity of soft tissues. Another serious problem is that this exercise requires extreme mobility of the thoracic spine and glenohumeral joint. Most men over 40, especially those who have spent decades in sedentary jobs, simply do not have this mobility. The result? They compensate by excessively arching the lumbar spine or forcing the shoulders beyond their natural limits, dramatically increasing the risk of injuries to both the shoulders and spine. The simple and much safer alternative is to perform the military press from the front. This variation allows your shoulders to move in a much more natural pattern, respecting the individual biomechanics of your joint. The frontal trajectory significantly reduces compression of the rotator cuff and minimizes stress on the anterior shoulder capsule. Additionally, the front press allows much better visual control of the trajectory of the bar or dumbbells, which makes it easier to maintain perfect technique. You can also easily adjust the width of the grip to find the most comfortable position for your specific shoulders. And don't forget, the same applies here as for the bench press. Always keep your elbows in front of the shoulder line. Exercise 1. Parallel bars. The main problem with parallel bars is in the extreme position that the shoulder assumes in the deepest part of the movement. When you go below the level of the bars, your shoulders are forced into hyperextension combined with internal rotation. In this position, the head of the humerus is pushed forward, placing enormous tension on the anterior shoulder capsule and the glenoid labrum. Constant repetition of this stress can lead to micro-injuries that, over time, evolve into more serious conditions such as anterior shoulder instability or labrum injuries, which, as we've already explained, are problems that frequently require surgical intervention. Another concerning aspect is the disproportionate load on the rotator cuff muscles, especially the infraspinatus and teres minor, which work intensely to stabilize the humeral head during the movement. With the natural decrease in strength of these muscles with age, they may not be able to provide the necessary stabilization, increasing the risk of subluxations or more serious injuries. Signs that parallel bars are negatively affecting your shoulders include pain in the anterior or deep part of the shoulder during or after exercise, sensation of instability or discomfort that radiates down the arm. Some men also report an occasional locking sensation in the shoulder, a sign that should never be ignored. The good news is that you don't need to completely abandon parallel bars. With some critical corrections, it's possible to make this exercise much safer for mature shoulders. Limit depth. It's not necessary to go down until your shoulders are below elbow level. A moderate range, stopping when your arms are approximately parallel to the ground or slightly below, provides excellent muscle stimulation with drastically reduced risk. Keep elbows close to your body. Avoid letting your elbows open to the sides, which places even more stress on the shoulder joint. Keeping them close to the trunk increases triceps work and reduces tension on the anterior structures of the shoulder. Lean your trunk forward. A slight forward inclination of the trunk shifts part of the work to the pectoral and reduces shoulder hyperextension in the lower position. And now we need to make something very clear here. We're not saying you need to completely eliminate these movements from your training routine. What we want to emphasize is the need to approach them with knowledge and caution, especially considering the natural changes that occur in our joints over the years. As we mentioned at the beginning, these exercises combine two significant risk factors: a naturally greater injury potential for more mature shoulders, and a margin of error in execution that can amplify this risk. Unfortunately, we know that not all gyms offer the professional support needed to correct small technical errors that, over time, can result in significant damage. True wisdom in training after 40 isn't about training less, but training more intelligently. If you liked this, and also want to discover the worst mistakes that most people make outside the gym without even realizing it, and that throw their effort in the trash, we left a video appearing right now on the screen showing and better explaining each one of them. Don't miss it. Thank you for watching this far, and may God bless you, my friend.